The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. Welcome to the Patient Talks. On this week's episode, we're going to be discussing the tick-borne diseases. We're going to talk about the most common ones, some of the symptoms to look out for, prevention, and why a tick bite could turn you into an involuntary vegetarian. I'm filming this in late April, and that means in most of the country, spring is in full bloom. And that means outdoor activities, hiking, gardening, yard work, canoeing, fishing, and for some people, turkey hunting. All of those things have one thing in common, and that is the potential for getting bitten by ticks. We've all had it happen. But there are several diseases that can be due to a retained tick bite. I could literally do an entire show on nothing about tick-borne diseases, but I always keep these episodes to less than 10 minutes. So we're going to kind of paint a broad picture. The most common ones we see here where I live in Arkansas is Rocky Mountain spotted fever, Ehrlichiosis, and a few scattered cases of Lyme disease, and another one called STARI. Let me go and get that last one out of the way. That one stands for Southern Tick Associated Rash-Inducing Illness. In English, it's one of those that it looks like Lyme disease, could look like a Rocky Mountain spotted fever or Ehrlichiosis, but our tests come back negative. So we don't know exactly what the causative organism is of our patient being ill, but we know it was related to a tick, we know they've got a rash, and it responds to the antibiotics that we typically use for Rocky Mountain spotted fever, Ehrlichiosis, and Lyme disease. I'll occasionally have a patient that says, hey, I had Lyme disease in the past, but when I dig down through their chart, their Lyme panel was negative. They probably had STARI. As far as what puts you at risk for the tick-borne diseases, it's how long the tick is retained. It takes somewhere between 4 to 6 hours for the tick bite to end up being a two-way transmission, where instead of just the tick is taking in things, now some things are being deposited into your bloodstream. So the hallmark of prevention for tick-borne illnesses is check yourself for ticks. Usually what I tell patients to be on the safe side is after a couple of hours of an outdoor activity, it's time for a tick check. And then particularly when you get home from whatever you're doing, another one, again, usually with a partner. And to be completely honest on that one, don't get distracted by the fact you're looking at your naked partner. Focus on the job, okay? I've had a couple of patients that, sure enough, caught something. They had help, but the help got distracted. Most common presentation on Rocky Mountain spotted fever, Ehrlichiosis, Lyme disease, and STARI is the patients feel ill. They're running a pretty good temp, anywhere from 102 to 104. The rash may or may not be there, so don't focus on no rash. Typically, it's joint pain, headaches, muscle pain. You feel ill. About 35% of people who present with what turns out to be a tick-borne illness have no memory of being bitten by a tick, but when you track back through their history, they have been doing activities previously that made it more likely that they've been bitten by a tick. Symptoms usually show up somewhere between 2 to 14 days after you've been bitten by a tick. But remember, the window of that tick biting you, 4 to 6 hours afterwards, is when the potential of these diseases coming on board. Prevention is a two-parter. First, we don't want to get bitten by a tick. So to start with, you want to tuck your pants into your socks. You want to use a good insect repellent. And as much as you can, you want to avoid tall grasses. There is a myth that ticks can jump or they fall out of trees. What's actually happening though, ticks tend to hang out on long grasses and wait for an animal to come by and brush up against it, and that's their opportunity to transfer over to you. So our first step on prevention is let's not get bit. Second part of prevention is we need to get the tick off before that 4 to 6 hour window has occurred. Tweezers. I can't say this enough. Tweezers. I know every home remedy out there. I've heard all of them, whether you're going to be using clear nail polish or alcohol. I've heard Vicks Vapor Rub. All of those, the idea is to suffocate the tick. And it may work, but it's going to take longer than the amount of time we need to get this tick off. So you always want to use tweezers. You want to get down just as close to the base of the jaws as you can, and you're going to lift directly off. Try not to twist. Most of the time the tick will come off cleanly. Occasionally you will still have the jaws kind of bedded down into the skin. If that's the case, try to get them off. If you're not successful, a little bit of antibiotic ointment and keep that area covered with a Band-Aid, and the body will usually clear that out without any problems. I had touched on a lot of the symptoms associated with the main tick-borne illnesses, which is high fever, joint pain, muscle pain, headache. Frankly, you feel ill. If this occurs during the summertime, even if you don't have a memory of a tick bite, because remember, about 35% of these patients have no memory of a tick bite. But if you know within the past couple of days to 2 weeks, you've been doing activities that made the potential for a tick bite fairly high, get yourself into a clinic. There are medications to treat these, and like most things in medicine, if we treat early, long-term complications are pretty low, but if you let this rock, there can be problems. So if you have symptoms that look like, act like, smell like, even if you don't think you've been bitten by a tick, you need to go see your clinician. And lastly, a tick bite causing you to be an involuntary vegetarian. What happens on this? It's called an Alpha Gal allergy, also known as an Alpha Gal syndrome. What that is there's a sugar molecule that is found in the blood of other mammals that's not found in us. And when a tick has bitten something else and then comes in contact with you and bites you, that molecule can get transferred into your bloodstream, and it can cause you to have an allergy to red meat. So you suddenly have developed an allergy to pork, beef, venison, any mammalian meat. And it can be very hard for us to diagnose because unlike most allergies where if you eat something you promptly break out in a rash or your throat closes, this one takes hours. It can take up to 10 hours after the ingestion of the meat for you to develop symptoms. So there can be a delay in diagnosis. It can last anywhere from 8 months to a lifetime as far as this Alpha Gal allergy. So if you like a good steak, if you like a good hamburger, and you're not afraid of the other rashes, maybe you'll have a little bit of fear of Alpha Gal syndrome. And that's going to do it for this week's show. That is the tick-borne diseases. I hope you've enjoyed the show. I hope you've learned something. If either one of those is true, please click the like and subscribe button down below. If you think there's somebody else that needs to see this, hit the share button. Until next time, you better make me look good. See you soon.